Okay, now I'm going to show you the second splint, which is a forearm splint using the already pre-made fiberglass, which is come in the box like this big. What you need to do is you get it up, and again, you can use anything tape measure to make the patients, and you're going to use again the side who is not an effective size, and you're going to use this 2-finger back again because you measure it to get it, and right away you're going to go to the splint. And you can actually go to measure it for how much you need. For this kind of splint, you're going to need a scissors like this, real strong to cut it, because it's not easy to cut this material. Trying to give a couple inches more because you're going to cut it out back, okay, like a 2. And after you cut it, you have to make sure you get this splint and you make sure that you put it inside real good. If it's not, it's going to dry it up. And you have this clip. It's like a potato chip clip. You actually have to click it on, and sometimes it's not easy to do it. Click it. Okay, to keep it sealed up, so you can put it inside. Now you have to use your glove, or you can peel it up, get it out of here. This is your splint. The splint, for you notice when you cut it, you have this fiberglass, which is a real danger one. I like to usually peel this because it's real easy to do it. I like to peel, and that's what I say, to cut a little bit more longer, because I always like to do this. I'm trying to make it the more circle that I can, and I can actually put it back again and pull this padding back. It's real easy to do it. You're going to do it both corners because you can see the sharp, real sharp edge is in here. You do the same thing. You peel everything back. You cut it. And you do the same thing back again. You're going to try to pull this edge the most you can. After you have this, you can actually, I always like to put an extra padding. And this, even though this has padding already, maybe I like to put maybe 1 or 2 layers more. This is 2 layers in here. I maybe going to use 3. For make comfortable, and again to prevent sores, like to do it. Again, I fold everything back to make sure that it's okay. It is fine. I measure it. I measure it to make sure that I got the right side. I don't have to fold it over there. If I have to cut it, it's better cut it before you put it in the patient. My splint stop in here, and in here it is look like it's pretty good. And now what I do is I get my gloves on. I get my 4-inch. So I think it's the easy way to do it when you have a bottle of water like that. The only thing you have to do is look like a X, and you do in both sizes, a little water and this plane like that. And after that, you have your towel. You put it in here in the towel, and you go to roll it inside the towel. And what this does is to get the excess of the water. And the same thing, you squeeze this in, the water go all around the splint. Now what you do is you roll it back again. You got it up. Remember, you put water. This is set more quick than the plaster. You have to move a little bit quicker. See, what I do is I put my extra webber. I fold the edges all the time. And now I'm going to put it in the patient. Remember, the part that you put it, again, Parma clip, down, and you go to molder. This one looks a little bit longer. I can actually fold it out because I want to from here. I try to mold it the best I can in here. Okay, hold it in there. I get again my band-aid. Again, I do not stretch this up. I go 1 here, go around 1 time around the thumb. And after that down, you're going to go 1.5. That way you're going to have enough to do this. And do not stretch it up. You can see, do not ever stretch this up like that. If you do this, it's too tight. You have to make it this way, which is the normal way to do it. and the end, you can maybe leave a little bit, but you can still see it's still looking good. After what you do is you position your hand, which is this is the normal way go, and again you're going to more this with your palmar grip, not with the hand, not using your fingers. I'm using this part of the hand to actually to more this splint. I don't want no fingers mark in there at all. In the same time, I'm trying to give it the same conform of the arm half. And the same thing, I'm controlling my wrist to keep it in the position that I want this to be on. This is the way that you add more this kind of, because this is fiberglass. Actually, fiberglass set like in 5 seconds. It is going to be hard enough that you can let the patient go. You can see you only go one time around the fingers. You actually don't need more than one. And after that, this is the splint.